The Honorable Bob McMullen, Parliamentary Secretary for International Development Assistance, distinguished representatives of the Indigenous community of Australia, Excellencies, distinguished permanent representatives to the United Nations, ambassadors, Dr. Mary Norton, Chairperson of the United Nations Department of Public Information NGO Conference, distinguished members of the NGO community, dear UN colleagues, dear friends, good morning. It gives me a great pleasure to welcome you to the 63rd Annual United Nations Department of Public Information NGO Conference. What a wonderful and moving greeting. I thank the performers for that very warm welcome. This is the only the third time in the history of the conference that we meet away from the United Nations headquarters in New York. 2 years ago, we met in Paris. Last year in Mexico City. We have this year come to Australia in recognition of this country's strong support and rich and varied contributions to the United Nations since its foundation in 1945. And we have come to the beautiful city of Melbourne in recognition of its history, culture, and care for their citizens, as well as for its embrace of those from around the world. I would like at the very outset to express our deep thanks and appreciation to the federal government of Australia and the Victorian state government for the commitment and energy that you have brought to this conference. Our special thanks goes to His Excellency Mr. Gary Quinlan, Permanent Representative of Australia to the United Nations. I would like to acknowledge the presence of Senator Helen Kroger, representing the Leader of the Opposition. I would also like to thank the Melbourne City Council and the wonderful people of Melbourne for hosting us so generously. Thank you, Melbourne. Thank you, Melbournians. This Melbourne Convention and Exhibition Centre, which we'll call home for the next 3 days, is a marvelous facility. We thank Australia for the modern and spacious setting in which we meet. We are here to take action on what is surely the most important and pressing issue in the world, global health. Every culture, from east to west, north to south, shares a similar proverb. If you have your health, you will have your health and wealth. The fate of nations is inextricably linked to the health of their peoples. We see this again more acutely in the current state of Pakistan, where 17 million flood victims now face an emerging health crisis with mounting cases of waterborne and communicable diseases like cholera and diarrhea. The United Nations and its partners are working with the government and people of Pakistan to address the massive human health and economic challenges that the country is now facing. In nations across the world, it is clear that investments in health yield significant returns. Study after study shows that investing in good health is quite cost-effective, that investing in women and children reduces poverty, and that investing in health stimulates economy. Indeed, health is at the very core of the Millennium Development Goals, that set of 8 internationally agreed, measurable, quantifiable goals aimed at reducing poverty, hunger, and disease by 2015. Achieving the Millennium Development Goals is essential for peace, development, stability, and for addressing human rights, equality, and equity. Less than 1 month from now, world leaders will meet at the United Nations for a summit on the MDGs to make a strong push for the achievement of the goals by 2015, a mere 5 years away from now. Therefore, this conference is a crucial opportunity for your voices, the voices of civil society and NGOs, to be heard at that summit in September in the UN headquarters in New York. It is an opportunity for all of you to find ways to narrow the differences between public health policy and pledges and the often harsh reality of people's everyday lives. And it is an opportunity to mobilize action for health where it matters most, in local districts and communities. Over the next 3 days, you will examine a broad range of issues related to global health, poverty, and human rights. These are indeed complex issues, but I have no doubt that each of you will continue to play an important role in the growing global coalition for health and in fulfilling the promises of the MDGs.